Americans consume 80% of the world's opioids, and we represent about 4.5% of the global population. What the hell is going on?
That's a big question. We have to start with math that adds some context to that statistic. That means that Americans use about 19 times more opioids than any other country in the world, if there was a close second.
Mm-hmm.
That's crazy. And now the argument for why it might be possible is because we have more access to great stuff. The other argument that's a positive would be our doctors are better at prescribing things that keep us safe and healthy.
Mm-hmm.
I think the real answer is pretty simple, and I'm glad that it's come out over the course of the last several years. Opioids are really profitable.
Mm-hmm.
They're profitable for the pharmaceutical companies who create them. They are legitimate problem solvers for the people who are taking them.
Yeah.
They work when they're used in the appropriate course of 1 to 3 days. And then doctors who have people coming in looking for them are only going to get a second patient visit if they give the patient what they want. And there are plenty of doctors' offices out there who are happy to write scripts to keep patients happy so that they keep patients in their business.
Mm-hmm.
It's an interesting thing. I talked to Dr. Spencer Nadolsky about the idea that doctors do and do not make money off of prescriptions. Because outside of like the recent vaccine for COVID, doctors haven't really gotten paid for writing a script directly. But if you think about how we consume doctors' offices, because they are a business and we are consumers who are using their businesses, they monetize patients wanting to be there. Mm-hmm. And if there's one doctor's office in town who will give everybody the script that people are coming in for, and the rest of the offices won't, well, then that one office is going to get all of the patients who want scripts.
Mm-hmm.
Unfortunately for you and me, specifically you and specifically me, because of the way that we want to live in the society we want to live in, most people prefer a script to the personal responsibility and the work of resolving their problem. And that work might be physical, it might be mental.
Well, I think that's a hard one I think that needs to be a full stop, and people need to wrap their head around that completely. So what you're describing is that you believe most people would prefer a prescription to make something less uncomfortable now than take the long-term and more comprehensive responsibility to become the person who is devoid of that problem in the first place.
Yeah. And that's borne out through any conversation that anybody wants to have with a highly ethical medical doctor. Find a medical doctor who works in an insurance-based practice and ask them these questions.
You're saying they'll tell you that?
They'll tell you. They'll tell you that they would love to give people more lifestyle advice in their clinic, but that most patients don't want it. They come in asking for the medication that they want. They come in asking for a medication if they don't know the medication that they want. Can't you write me something for XYZ? And so even if you're a doctor who prefers to give people lifestyle advice, referrals, all of those things, you have to be really strong mentally and very focused to avoid the easy trap to fall into that is assuming the next person just wants a script also. Because imagine if all day long you were telling people you'd rather them try lifestyle, you suggesting lifestyle, and their response was, no, just give me a medication. I'm not here to change my lifestyle.
If that's the response, then I would agree. I'd be curious how many people are actually saying that compared to people who don't know what they don't know about how that would even be possible.
I'm not in the offices asking the questions. And I trust the doctors I talk to.
Understood.
It's high.
So they're hearing,
no,
I'm not interested. I want this.
Mm-hmm.
I see.
Yeah. And look, I saw it when I was in clinical practice too. They knew they couldn't get a script from me. But people would absolutely come in and ask about like how I'm going to fix this for them.
Right. Whatever the treatment was.
How is this going to fix it?
Right.
This is not going to fix it.
Mm-hmm.
This is going to create a window that's going to allow you to fix it.
And that's something that I can attest that I have heard you in your office say many times.
Mm-hmm. But look, I'm not in my office anymore.
Yep.
It became really tiresome The two questions people used to ask most often were, how much does this cost and how many times do I have to come?
Right.
You work with people when they're feeling terrible, when they're feeling okay, when they start to feel good, and then they're gone. And I never ran the kind of practice where I felt like people needed to come back to me for maintenance. I always thought that was kind of a nonsense line that keeps businesses operational but doesn't actually solve for the patient's problem. Because, and I used to argue this with my chiropractor friends all the time, if I have a cut on my forearm and the cut heals, then you're the doctor who gave me the stitches. I understand having to come back to check on the wound. I understand having to come back to get the stitches removed. I understand having to come back a month after the stitches were removed to make sure that there is no infection, that everything is good. But then I have skin. Why do I need to keep coming back in so that you can try to remember where the scar used to be and make sure everything is okay? When I'm healed, I'm healed. And so I didn't enjoy clinical practice because it was just a constant state of trying to meet people where they were, which was emotionally low. Now I imagine adding to that.
And relatively unmotivated, it sounds like.
Well, no, my patients were pretty motivated. That's why they were coming to me specifically. But I saw a patient every 15 to 20 minutes. And my initial visit was over an hour. I'm imagining a world where my patient visits take less than 5. And everybody wants a medication. And I have a line of patients waiting.
To be clear, you're describing the state of the
traditional
medical
medicine
system right now.
Yes.
Yeah.
Yes. Go to an urgent care, go to a primary care doctor's office. There are people in the waiting room. Nobody, if I said to you, you're going to go to the doctor today and no one's going to be in the waiting room, you'd be like, what? That's odd. That's crazy. Just think about that as a premise. There's
the idea is someone's coming in. I want to make sure I'm following. Someone's coming in for an appointment. They're being seen. No one's there if it's not their appointment.
The premise that it's crazy to imagine going to see a doctor, getting to the waiting room, and all of the chairs are empty. You're coming right in. No, we all expect to have to sit there for a while,
right?
Because there's a queue in front of us, and when we leave, we expect there will be people in the waiting room after us.
I understand.
That's a lot of people needing to see a doctor every day.
Yeah. Well, when we talk more about pain, now we can put together, the case you were trying to make for the alternative arguments around the 80% opioid consumption, which still in part might be valid. But we consider another statistic, which is that about half Americans every day report musculoskeletal pain. And now it's like, well, it's kind of hard to hold up that it's just because it's available and it's being these people are in pain every day, half of them that are documented. And the tricky part for me that I know that you can explain a little better is there are a lot of institutions that are designed to get people and keep people out of pain. Why does this number still exist?
We have to start with what the goal of the medical system is, and then we can talk about what the goal of the fitness system is, and we can talk about the space between the two of them. What's important to understand about the medical system is that it's still over 90% of it is dictated by what insurance will and will not pay for. I made up that 90% number, and I would challenge anybody to prove it otherwise, and I imagine they won't be off by more than 5% either way.
So in other words, to be clear, insurance tells practitioners, here's what you're going to do and how you're going to do it, and then we'll pay you for the service.
That's a bit of a reach. It's more that doctors are business people. They have to be. They're not going to provide services that are not going to be reimbursed by an insurance company because they understand, first of all, it's unethical to just throw $1,000+ service onto a patient before you check with the insurance company and then saddle the patient with this bill. I forget what the number is, but an alarming number of Americans can't afford a $400 emergency medical expense. It would bankrupt them. That's
rough.
Really scary thought. But so there's an ethical line that the doctors are trying to toe to ensure that the insurance company is going to pay for the care that the patient is going to receive. I respect that.
Same.
The insurance company is only going to pay for care that it deems is medically necessary. So now we have to look at what's medically necessary. Across let's stick in the musculoskeletal fields because that's what you're asking me about. Medically necessary is typically constituted by a definition that it impairs one's ability to perform an ADL, an activity of daily living. An activity of daily living is something that the insurance company and the medical community would mutually agree is necessary for a regular person to do on a regular day, every day. Wipe your butt, brush your teeth, comb your hair, drive your car 15 minutes, walk 5-10 minutes uninterrupted, sleep through the night. Those are examples of activities of daily living. Now, imagine that you go to the doctor because you can't wash your hair because of shoulder pain. Their insurance is going to stop paying them if they show that they're not making progress towards you being able to wash your hair. As soon as you can wash your hair, insurance is going to say it's no longer medically necessary for you to be seen by this doctor. We're talking right now about physical therapists, chiropractors, even athletic trainers if they're taking insurance under somebody else's license, nurse practitioners, medical doctors who are writing scripts. Orthopedists would MRI that and then send them somewhere else because they're not going to get paid on a surgery for that. So as soon as you're washing your hair, you're no longer in need of an ADL. And so you're released. Okay. Some doctor's offices, physical therapy or chiropractic, will charge you cash at this point.
To continue care.
To continue care. Because those are doctors who typically are going to have a little bit of advanced education in regards to how
They can take you a little further.
Yeah, on work capacity, into moving into fitness at this point.
Well, this is where I think it's crucial for people to understand who might not know that this is where they've been and where they might end up being so they could see it and know what they're looking at. You've been a relatively healthy person who's tried to live decently in terms of habits and lifestyle. You've got a shoulder surgery. It's bad. It's repaired. It went well. You've got 12 weeks of physical therapy. And now you can slowly lift your arm to shampoo your hair with your left arm, which you couldn't do for a while now. It hurts maybe 3 out of 10. This is the point at which you might be for you to trepidatiously with a 3 out of 10 pain be shampooing your hair with your left arm. That insurance would have already said that's good enough. We're not going to pay for that anymore.
Yes. There's also, like, stretch that all the way out to a better scenario. You're not in pain anymore, but you're still scared. You don't know how to use this shoulder in the real world. And physical therapy is releasing you with pamphlets of exercises and ease back into it. That's the range of what you're going to get before insurance runs out. Insurance runs out and you're either out of pain, you can do the activities of daily living, but you can't imagine throwing a ball, pressing a weight overhead, throwing your kids in the air and catching them, trying something new with your arm, golf, whatever. The other angle is you're still in some decent pain, but at least you can do the things you need to do to get through your day to day. This is where my father was after he tore up his shoulder. The medical, his insurance was over. You are permanently disabled. How
old was he then? 40-something?
Nah, like 57, 58.
That's more recently than I thought.
Yeah. Permanently disabled, you'll never be able to use it again. Okay.
That was an official medical indictment?
Yeah.
Wow.
Yeah, that's what ended his career seeing patients. Because he has a very, being a chiropractor is a very physical job. So that's what the medical and the insurance industry will cast upon somebody. Most people take that as gospel. Most people just believe that.
This is my life now.
This is my life now. That's, to me, all the way on the left of the spectrum, all the way on the right of the spectrum is I feel good, but I'm afraid to use it because I don't want to make this worse again. That's where medical ends. You follow me there? And people are often frustrated at the end of medical, but resigned. I was with a group of people the other night who were frustrated at the end of medical, but resigned at a 50-year-old's birthday party.
What do you mean, but resigned?
Resigned to the fact that this is just how things go. I was with a bunch of 50-plus-year-olds. I'm 40. I was the young chicken at the party. And They were all talking about this hurts, that hurts, this hurts, that hurts. But that's what happens.
Wait till you get 50.
Not even wait till you get 50. There was none of that. It was just the consensus was something's going to hurt. Some people were frustrated by that. Some people were just like, look, it lets me know I use my body. I'm good with it. Either way, I feel like they could be living better. But that's one end of the spectrum. The other end of the spectrum is you're hurting every day. And there's nothing that you can do about it. The physical therapist isn't going to do something about it because you're not going to get insurance for it. The chiro isn't going to help you. And you don't want to be taking medications, so you just deal with it. That's the end of the medical opportunity for most people. You follow me there? Mm-hmm. What happens next is, and by the way, that's after things like cortisone shots, epidurals, all of that stuff would have happened before we got to here. The other end of the spectrum is the fitness industry, where if you walked into a good gym and said, I had this shoulder injury years ago, got surgery, got physical therapy, I've just been afraid to use it, they're going to say the responsible thing, which is, look, if it hurts, we'll just work around it. Mm-hmm. We'll find other ways to get you the fitness that you're looking for without using that shoulder. That's what would happen in a good gym. And that is what they're supposed to do. Mm-hmm. That is the scope of that gym. That is the scope of the coaches in that gym. It is their job to keep you safe. But now what's happened is both the fitness industry and the medical industry have told you, we don't have an answer for making your shoulder feel better. Mm. We don't have an answer for giving you back what we call activities of daily interest.
So medical said, this is about all you're going to get out of your shoulder. Fitness says...
Or you might be able to get more, but you got to go ease into it with a fitness professional.
And fitness will say, I don't really know what we can do about that, but we can help you in all these other ways, so we're just going to stay away from that.
Yeah, or you hear the nonsense like, we'll strengthen the little muscles around it, the small stabilizer muscles. Like, my friends listening to this, there is no such thing as a small stabilizer muscle. There are muscles. Mm-hmm. Some of that, like every muscle can either lengthen a joint. Really, muscles only shorten, stay the same length, or lengthen under tension. If they're shortening, they're also shortening a joint. If they're staying the same length, they're stabilizing a joint. If they're lengthening, they're decelerating a joint.
Doesn't matter how big or small the muscle is.
That's it. It doesn't matter. Mm-hmm. They all do the same thing. Mm-hmm. Every muscle does the same thing. There is no such thing as a tiny stabilizer muscle that is made better by taking a kettlebell and putting it upside down and carrying it around. Mm-hmm. You are creating more stability in the same muscles. Mm-hmm. That's an aside. So what happens is you get blessed with this diagnosis that is your forever diagnosis. You're just not going to be able to use that shoulder the way that you were used to. Get used to it. This
is what Louis C.K. in his stand-up would call incurable shitty ankle that the doctor told him he had.
Is that what he...
Yeah. You just have incurable shitty ankle now.
Right. And so I saw this, like I was in the unique position of being in a clinical practice after being a personal trainer for a decade. And I had patients who were flying in to see me for stuff because I was the only person helping them get out of pain without missing their workouts or having to go back to the doctor again. So we would say, get out of pain without going to the doctor or missing the gym. It's easy for people to remember. I said that 20,000 times. But what it really was, it was more than just don't miss the gym. It was get out of pain while restoring full activity without going to the doctor or missing out on your active life along the way. That became really, really popular. And people started flying in to see me from all over the world. And then we started to build out how can we help people do this remotely. And that's where the RX division started of our company.
So this is really born out of the idea that medical ends too soon. Fitness doesn't know where or how to pick up. Mm-hmm. There's this huge wasteland in between where 50% of Americans are reporting musculoskeletal pain every single day. And neither one of those industries are actually doing anything about it.
Yeah. It starts with the language of I'm in pain every day. What does that mean? Mm-hmm. And I'm not going to go into how we define pain at Active Life. I'm not going to go into how we help our clients rewire their language so that everything that they say is productive in terms of it communicates something specific. If you say you're in pain today and I say I'm in pain today, we might not be describing the same thing at all. It could be very different. Most doctors' offices are not teaching patients this, and I haven't met a gym or a coach outside of our clients who are talking about this with their clients. So it's everything from being able to articulate what you're actually feeling to being able to hear what someone else is actually articulating to then having a plan around how to make that better.
What about this idea that there are a lot of people who either don't believe or aren't sure they ought to decide to believe that it could actually be different?
You're talking about the person who's today their back hurts. It's been hurting for 2 years. It's okay as long as they don't carry the luggage.
Right, whatever it is.
Right. And they're just thinking, look, I was way worse once. This is pretty good compared.
Right.
I don't want to risk going back that way. Is that the person you're asking me about?
100%.
I have a lot of empathy for that person. Pain, especially severe pain, can be a really scary thing, especially if you don't understand what's causing it, how to resolve it, what the signs are that you're on your way to experiencing it again, what the signs are that you're on your way to never experiencing it again. So I can understand why that person would be in that state. The things I think that person is perhaps not recognizing is the psychological toll that actually takes on you and how that psychological toll becomes a physical toll. Someone who's living like that, I would wager, it'd be interesting to look and see if there's a study on this. I would wager is spending more time in fight or flight than a person who doesn't live like that. Fight or flight is a nervous system response that is meant to come on when we are supposed to fight something or run from it.
Emergency.
That's it. And so when we live in fight or flight, even if it's low grade, it leads to all kinds of getting sick more often, immunological disorders, inflammatory disorders, disease processes, all of this stuff. And the best example I can give to people, especially if you've ever been a parent, is it leads to sleeping like you sleep in the first 4 months of your new kid being born, where you're like, the slightest sound wakes you up because I have to do something. That's what it's like all day, whether you realize it or not. And so you're not recovering effectively. Your workouts are less intense than they otherwise could be. Your ability to recover from everything that you're doing is lower because your sleep isn't going to be as good. You're not going to digest food as well. All of these things are very legitimate when it comes to living in any kind of chronic pain or any kind of chronic fear. And so I empathize with that person. And what I would like to ask them is, what if it could be better? That's the only question that needs to be asked to start. What if it could be better? If you knew it could be better, not that it will, but it could, would it be worth it for you to find out how and what the risks would be associated with that? That's all that the person in the state you're describing needs to be thinking about.
And there'll be some of them who say no.
Then I have nothing for you.
Then there's nothing for you. But
Not
there are
from
going to
us.
be, but there, right. But there are going to be some of them who say, I mean, if it could, that would be amazing. I mean, I don't know what that looks like. But this is the beginning of, I'm open to the possibility.
Well, so let's talk about what that looks like. I don't remember the woman's name. And if you do, just use her first name. But she was a one-on-one client years ago who I sent your way after enrolling her. She was in the admissions office at University of Texas or something like that. Nadine. When Nadine started with us, she had shoulder pain. And on the call, she cried with me because she's so frustrated and exasperated of all the things she's tried to do. And I had her do high pulls with no weight on our call just to see, can you even do this? Like, are we even going to be able to provide you the support that you need? Or are you so acutely inflamed that this is not going to work? She was able to do them without any weight. And I remember saying to her, if you can do that, all we need to be able to do is gradually add load to that. And you're going to be able to do that without pain in the future at loads that you can handle. So for example, in the moment, she couldn't zip up her jacket. That was the thing that was driving her through. Well, can you do it without the zipper? Like without the weight of the zipper and like having to forcefully pull it up? Yeah. Okay. So then you will be able to do it with the zipper. Her shoulders dropped. Her discomfort reduced right away. Mm-hmm. Then we started talking about what is pain on the sales call. And once she understood that pain is really just a negative emotion that's tied to uncertainty brought on by irritation, and that sometimes we need irritation to drive adaptation, we built safe confines around what she can and cannot feel. And she was able to zip her jacket. I don't know how long it took her working with you to be completely out of pain. Do you remember?
I don't remember.
But that's a really good example, I think, of a person who you don't necessarily know how until you get into the conversation with them. And then you can start to evaluate for opportunities. And it becomes very obvious very fast.
What else is something that you want everyone to know around why the thing isn't working right now and what they should be looking to or thinking about if they are in a position where they're ready to actually do something about it?
The education just doesn't exist, frankly, outside of what we're doing. Mm-hmm. And I've thought long and hard about saying things like that. So absolutely. And I've come to just decide I've looked. It doesn't exist outside of what we're doing. What has to happen otherwise, because there are other people who can do it.
Right.
But what's happened is those people have cobbled together a bunch of different educations. So it's often going to be physical therapists or chiropractors who graduated school and said, this isn't adequate.
That's what happened to you, right?
Yeah. And then went and got some kind of probably a soft tissue education, some kind of a performance exercise education. They might have done some psychology. They might have done some communication. And all of these skills kind of congeal to being a practitioner that's really hard to name. And so there are some really great people out there who can do this as a result of their personal quest for all of the missing pieces that their patients have needed along the way. We do it on purpose with the students who we teach. So I'll give you an example of why I'm saying the education doesn't exist. Medical school uses less than 1% of its curriculum. And 1%, by the way, is really generous. It's probably less than half of 1%. It's definitely less than half of 1%, now that I say that out loud. To teach nutrition and to teach exercise. Think about that. Medical doctors do not learn about nutrition and they do not learn about exercise.
So in a 4 to 8 year education, we're talking about maybe they talked about it for a week.
No, we're talking about fewer than 8 hours total. Yeah. So now you might be thinking to yourself, well, why is that relevant? Who cares? Like, they're not teaching people exercise and nutrition. Well, the CDC says that 90% of type 2 diabetes could be cured through diet and exercise interventions. The American Heart Association says that 80% of cardiovascular disease could be cured by diet and exercise interventions. And the American Cancer Society says that up to 42% of cancers can be remediated by diet and exercise interventions if done prior to the patient getting the cancer. So what I want to, like, what's clear, what I want to caveat there for
the last
cancer,
one is 42% of cancer wouldn't happen if the person made change.
up to 42% of cancer. They didn't come out so strongly as to say 42% wouldn't happen if. They said that there are confounding factors, but that these 42% of cancer cases would be significantly less likely with diet and exercise being different.
That's meaningful.
It's extremely meaningful. When you combine the number of people who die of those 3 diseases annually, just in the United States, it's over 1.4 million. So if we took an average of the 4 of them, because cardiovascular disease is the most number of people, followed by diabetes, followed by cancer, so the 2 bigger numbers, let's just say that's 75% of 1.4 million people.
Of those conditions, yeah.
With that, we're saving 800,000 lives a year.
Yeah, it's a lot of people.
But the medical school curriculum doesn't prioritize that. Now, I think that there's a good argument for why they wouldn't prioritize that. It starts with, you're not supposed to come to a doctor to not get sick. Mm-hmm. You're supposed to come to a doctor after it's too late. I'm not saying that's the case. I'm saying I think that that's a reasonable argument if that is the case for not teaching fitness and nutrition. I can't think of a good one otherwise. Okay. Now, who should? Physical therapy. Let's just say physical therapy. 48% of physical therapists, I believe it's according to the American Physical Therapy Association, the APTA, but don't quote me on the source. I just saw this last week. Someone sent it to me. When polled, indicated that they do not believe they have the skills necessary to write exercise programming for patients after care is complete. Those are the ones who know what they don't know.
Yeah.
And that number, by the way, I have 3 numbers in my head. So I'm somewhere in there. It was either 42% or 48%. And that was either do or do not believe. So that was the best it could possibly get. Okay. Anyway, so they're not taught that. I went to chiropractic school. We did not learn exercise in chiropractic school. Like, we learned basic, like you're talking about posterior pelvic tilts and bird dogs.
Right.
Okay. There isn't a profession in the medical industry that's taught about diet and exercise. Great. We got some nutrition education, but it was very cursory. Now you move into the fitness world. Well, you would say, okay, great. Well, that's their wheelhouse, right? In most states, to become a licensed personal trainer, and licensed is the operative word, to be a credentialed personal trainer, to be insurable, you need a high school diploma, a GED, a high school diploma or a GED, and a CPR certification. That's it. Now, let's say you go a step further. You take an ACE, personal training certification. That is out of a textbook.
It's a textbook.
Yeah.
And you need a 55 to pass.
Is that what it is?
Yep.
That's awful. I didn't know that. I didn't know that.
Yeah, dude. I think my first one was from NASM. I probably needed somewhere around that, 60, 65.
I remember a friend of mine who will remain nameless was at a job interview for Bally's. And he called me when the person left the room because he wasn't a certified personal trainer. But he was like, I'll take the test and I'll pass it. And so the guy's like, yeah, go ahead, take the test. Like, we'll load it up on the computer for you. So he paid. They loaded up the test for him, and he called me, and I took the test for him over the phone. And now he's a certified personal trainer. This is years ago. I would not do that now. But look, the point is, there is no efficacy in becoming a personal trainer that you know anything about anything. And there are some personal trainers who are great, who do know a lot about a lot. But it's incumbent on the individual to find them. And what questions do you even ask?
Yeah.
How do you know how to know if the person you're about to work with has a clue? You don't.
Well, in the same way that I think many people often struggle to advocate for themselves effectively in a doctor's office, they struggle to advocate for themselves with a fitness professional.
Of course. But it's because you don't think, frankly, you shouldn't have to.
Agree.
Those professions.
It doesn't occur to someone that they ought to. Right.
Because those are supposed to be collaborators, not adversaries. The doctor and the personal trainer are meant to be collaborators with the patient and the client, not adversaries of the patient and the client.
Yeah.
And when I describe adversary, what I'm describing is they will take your money without knowing if they can solve your problem.
What it comes down to is that the patient or the client should be, of course, that they trust these people to make good decisions with and for them.
Yeah. Yeah. And we need more of that.
Mm-hmm.
So now that's where we came in, right? And you kind of showed up on the scene right in the middle of us becoming the company who does this stuff in 2016?
Yep.
That's when people had just started flying in to see us. The reason why what we do works and isn't medical care or fitness is because, let's start with the medical. Let's start with why it works. It works because we meet the client where they are. Our goal is their goal, and typically their goal is to not need us forever. And so there's this adversarial relationship that starts when most people start with a personal trainer or even with a doctor who wants them to be there forever. I'm not saying all doctors do, where the goals are malaligned. You don't want to be with the trainer forever. You want to solve this problem and then go off and do it on your own. But the trainer wants clients forever.
Yeah.
So we first of all, we exist in that space where we don't. We want you to get your problem solved, and then we want you to go either downgrade to a less expensive service that we offer, stay with us because you want to, but not because you need to, or go work with somebody else and tell that person how amazing we were so that they end up referring to us also. Those are our 1, 2, 3 goals. The other thing is I will take some credit here. I come from both worlds. Mm-hmm. I've been a personal trainer starting in 2005. I became a chiropractor in 2009. I saw patients and clients at the same time until 2018. And then I started taking people online. Then I hired my friends. Then I hired people who could take what we were already doing and turn it into curriculum so that we could hire other people, but train them first, robustly. Then I was able to pull myself out of it in a way that I don't think most people ever get the opportunity to, in part because they don't try to or because they don't want to, and power to them. But I got to pull myself out and look at what do we need to do better as a company. And then we took an education that we once thought needed to be 12 weeks long and turned it into 13 months. It's over 1,000 hours when you include, quote, lab time for the people who are doing it.
Yeah.
Actually trying this with clients, doing their case studies. That's like 996 hours more than the average. So that's what we do to develop the person who's able to solve these problems for the clients who come our way, who we either take as clients or refer to someone we developed who's outside the company.
Can you describe, like, to the person who has been, for lack of a better term, let down by healthcare and fitness, who is in a position where they would love to be able to have more agency and autonomy in their lives, live a life of more freedom with less compromise, less worry, less pain. Can you describe some, like, imagine ifs that would meet them where they likely are to explain what they didn't realize they weren't getting?
Yeah.
But that would make it obvious that they need?
The simplest is imagine if instead of feeling overwhelmed, you felt completely in control. That's the easiest, because most of the people I talk to...
Control of what?
Life.
How you feel, how you move when you do it.
Well, the most, like, the common line that's out there that I really hate this sentence. People who say that they don't have time to work out just aren't making it a priority. That's a terrible sentence because it assumes people know how to work out, that people aren't afraid to work out, that people believe working out would get them to the goal that they have and not actually set them back, that people can trust the fitness industry to guide them on their working out, when none of those things are true. I polled my email list and I asked them to describe, what does the word exercise mean? Can you define the word exercise? And I got 19 different definitions. Many of them were not similar. Some of them were very specific. Some of them were very non-specific. But so my question to the fitness industry is, which one of those are you talking about when you say that a person who is not prioritizing working out or is not prioritizing exercise simply isn't making it a priority? Which one are they not making a priority? Which of the 19?
Mm-hmm.
And so that's overwhelming for the person who is trying to improve their life and is turning to a fitness community who's not even trying to understand them. So my answer to your question is, what if it stopped feeling overwhelming and you started feeling in control? Because that starts by meeting you where you are instead of asking you to meet us where we are, and then getting you to where you want to go instead of us trying to get you to go where we would like you to go.
So there's a person who you're much more completely and consistently resourced. I would even say mentored, guided, supported with the knowledge, the skills, and the tools to take control of the factors in your life that are controllable and claim a different feeling and position.
Yeah, all true. And even more than anyone needs to know. Right? So it starts with as simple of a question of, what if you didn't have to be overwhelmed?
Mm-hmm.
Because all we need to start with is, are you overwhelmed by this? Like the thought of starting a new exercise routine? Yes. Okay. What if you weren't? Well, then I obviously would start. Okay, well, what's overwhelming you? That's where the conversation needs to start.
And no one's having that conversation for most people.
Right, because that insinuates you might not become a client today.
Mm-hmm.
We might not be the thing you need to do. We need to figure out what's overwhelming you.
Instead of how do we get you to buy something?
Yes.
Anything else?
No. Turn pro. I hope you enjoyed this episode of the Active Life Podcast. Please remember, give us a hand, rate it, review it wherever you listen to shows. We are on a mission to humanize the healthcare industry by professionalizing the fitness industry to empower the individual to live a life unlimited by the way that their body looks, feels, or performs. If you are inspired by that mission and want to jump on the wagon, find us anywhere. Active Life Professional on Instagram, Active Life RX on Instagram. Come to me personally at Dr. Sean Pastuch. We want to welcome you onto the train. We want you to be a part of the mission. We want to offer you the opportunity to pursue this right alongside us. We're inspired by your effort, and we hope to help you in your journey. Turn pro.